Thank you so much for joining us today for our webinar. We have Hannah Schilling with us, who is going to be sharing about peer leaders co-creating a recovery-oriented system of care. I'm just going to allow a few minutes for people to hop on, and then I'm going to start going through our slides and sharing a little bit about Relink before she gets started. All right, I'll go ahead and start sharing our slides. So to tell you a little bit about relink.org, we are a web-based internet search that you can use from a cell phone, you can use from the computer, you can look at Relink many different ways, but you can click on relink.org, and when you go to Find Help Now, you will be able to find different categories that will come up. And within those different categories, we have over 16,000 resources that you can easily access in 3 clicks in 30 seconds. We have here where you can see you start by entering location, so you can search by city, zip code, or county. You have a mile radius, so you can search 20 miles, 40 miles, all the way up to 100, 200-mile radius from where you're at and where you're looking to find resources for. And then you can click on a category of care. I have addiction recovery, a little arrow to that today, because that's the area that we're going to be speaking on. But we have all different categories: reentry, human trafficking. We have emergency and crisis numbers, basic needs, behavioral health for any counseling services. And then once you click on one of those categories of care, the different options will come up. And here you can just see them a little bit more clearly, but you can see the different categories that we do have. Here I was showing that when you do click into addiction recovery, we have treatment, housing, peer, and other support services. Is what we're going to be talking about today and sharing about, and also harm reduction and prevention services. One thing that I always want to mention is that when you are a provider, you can easily edit your own data, or you can even create a page by just clicking provider login sign up, which you can see up there in the top right-hand corner. And by doing that, all it's asking you is your name and your email address. It's as easy as that to have access to your information. And someone from our office will contact you, make sure you work for that organization, you have the rights to edit the data, and then you can easily go in at any time and edit the provider page, update information such as phone numbers, contact people, hours of operation, anything like that can be easily updated. One thing that we're working on this year is our bed capacity. We're really pushing for people, if you are a provider that has beds that are open, if you have any that are full, it'll be red. If you have any that are open, you can make it green. And if you have an unknown, shows that nobody has updated that information within the last week. And that's what we're trying to avoid. We're trying to make sure that anyone who has beds will go in and quickly change the number of beds each week that are available, so that people can easily access that and see that when helping someone in crisis and in need. So at Relink, here's some of our information for our social media and our phone number, as well as our email address. You can call us at any time at the phone number listed, or email us at info@relink.org, and we're always happy to help. So I'm going to stop sharing, and I'm going to turn it over to Hannah. She's going to talk a little bit about what she does and give a little bit of an introduction. And then she's also open to questions. I know she said she really wants to make this interactive, so we'd love to have questions, and I'll be keeping track of the chat as well, so that we can answer any questions that people have. Thank you, Hannah, for being here today. We love our partnership and collaboration work with On the Front Line, so we're excited to have Hannah today.
Very honored, and I'm very grateful that you've invited us to come and for us to be able to talk about On the Front Lines, why we were created, how it naturally evolved, and where we are now, and talk a little bit more about our partnership. So I'm really grateful to be here, really excited. I do not thrive in a virtual environment. Just want to preface this whole. So please, if you have questions, put them in the chat. Are individuals able to like turn off their mics and talk through the conversation, or is this just a
Since
one-sided?
it's a webinar and it's a recording, it is just only chat, so.
Okay. Well, please put questions in the chat and I'd be more than happy to answer them throughout. I did see that some of us introduced ourselves and we have some peer supporters on the screen. Just to talk a little bit about who I am, where I come from. I've been working in Cincinnati, Ohio for the past 6 years in recovery support services. I'm a peer recovery supporter through the state of Ohio. I also have a clinical certification, but the backdrop and the backbone of what I do is sharing my lived experience and hoping that we can lift the voices of lived experience and put them at tables where decisions are being made about us. I live by the philosophy, nothing about us without us. So that's really what inspired the work that I do with On the Front Lines. And I'm going to just go into the presentation and we can talk a little bit more about what that is. So I'm going to share my screen and hopefully this all works out because I was having a hard time. See, okay. How are we doing,
Yep,
Rachel? Is
you
it
got it.
showing the presenter view? Okay,
Yep.
fantastic. Thanks for being flexible with me. Today, we're going to talk about peers being leaders and how we are helping create this recovery-oriented system of care. Again, my name's Hannah Schilling, and I'm the founder and executive director of the On the Frontlines Community Alliance. And first, I just want to acknowledge the value of peer support work. I saw that a few of you, when you introduced yourself as certified peer recovery supporters, so this might just be validating, but I also want to make sure that individuals on this presentation understand the value of peer support and what exactly peer support is, because over the past few years, since peer support has gained some traction and a little bit of publicity and it's become a billable service, it's kind of gotten skewed over time. So let's talk about what is a peer supporter. So we bring our lived experience of recovery into through combined training and education with supervision, which is extremely important, to help other individuals navigate the recovery system of care. And we offer strength-based support services, focusing on resource brokering and removing barriers. So you can see these are some like the big areas in which we focus. We inspire people. Inspiring hope is a major aspect of what peer supporters do. Reframing. So there's so many myths and misconceptions around what recovery is and what substance use disorder is. And so we kind of help break those down, not only to people that are seeking services, but also the professionals that work in this space or intersecting professionals that might work with people with substance use disorder. We link, of course, getting people connected through referrals to the resources that make sense to them based on their unique needs. And then we also offer understanding. So breaking down any kind of barriers, especially ones around power dynamics, right? So peer supporters are often charged with that, which can be kind of difficult. So I want to talk about the benefits of peer support. What do they include? There's a lot of them here. I'm not going to go through all of them, but there's so much evidence behind the value of peer recovery support and what it brings to the recovery field. So you can see increased social support and functioning, increased self-esteem, sense of ability to control, empowerment scores, sense of hope and aspiration, decreased substance use and depression, and reduce hospital admissions. So much can be, evidentiary supported by the work of peer recovery supporters. This is one of the challenges, though, is that when we look at the workforce in relation to how many people are needing services that would qualify for peer support, right now the number in the workforce is 23,000. Now, this was in 2020, so that's a little bit antiquated, but data takes some time to get current. What we need in the workforce, you can see there's a 97% space where we're not meeting the demands of the workforce. So even though it is evidence-based and even though we are seeing the need, there's not a lot of individuals working in, not enough individuals working in the peer support space. So that kind of leads us into like what are some of the challenges in making sure that peer recovery support services are held with integrity and maintaining their composure within the scope of their practice. So some of the challenges that we've seen is with employers. Um, Employers are having a difficult time recruiting skilled and competent peer recovery supporters. They don't have the budget in order to continue to develop the skills of people working in recovery support. And then there's a high turnover rate and low retention rate, because there is no career ladder or career advancement for peer supporters, what we often see is people leave the profession to go and do clinical based work, which moves away from the value of peer support, which is sharing our personal lived experience. So in the workforce, there's low incentives and opportunities to acquire the necessary skills or develop the skills that we would need to be successful in this field outside of the initial training requirements or training that is offered through our employers. Burnout. Number one reason that we're seeing people leave the field is the amount of demand that's put on individuals with lived experience without wellness initiatives or sustainability plans for people that are constantly sharing from a place of their personal lived experience. And um, the main component of our work is vulnerability, which isn't one that's often discussed. And what it would look like in like this taxing profession. And then we already talked about career advancement and the insecurity of moving through a career ladder. And in our community, we are facing unprecedented mental health and substance use. We have a severe shortage of behavioral health providers, including peer supporters, and then we lack access to the services and resources which is placing a lot of stress on our public health system. So through some of the challenges, we've learned a lot on what needs to come to the forefront in order for us to be able to meet the needs of the behavioral health and substance use workforce is peers need support entering and navigating the workforce. Employers need access to skilled candidates for peer supporters, and then the communities need culturally congruent services and providers. So this is when On the Front Lines was kind of formed. And this is where we talk about building a bridge. On the Front Lines was created to build a bridge between some of these challenges, and it kind of happened organically. So in 2018, 6 of us got together. You can see this picture. It's so old. It's really grainy because of how many times it's probably been filtered and edited. But this is the 6 of us at our first On the Front Lines meeting. So we were peer supporters. All of us, started in the field without any inclination or true understanding of what peer support was and what it was going to look like within our organizations. They had just recently integrated peer support. We all worked in different spaces. I worked for the quick response team, which was a law enforcement aided opiate response unit. We had people working at outpatient. We had someone working in the emergency room, somebody working for a commercial-based insurance provider, but all of us were working as peer recovery supporters. And what we realized is that we didn't have supervision. Our organizations didn't have an understanding of what our actual role was going to look like. And we weren't being guided by our organization. So what happened is we started coming together and guiding each other. So this happened naturally because of the confusion that was created because of a lack of understanding of what peer support is. And we started collaborating with each other. We started providing informal supervision and support. We were sharing the complexities of our roles, and we were offering different solutions in a group-based setting. And then we were promoting personal and professional growth. So we all know that there's a huge entanglement between our personal recovery process and our professional identity within recovery. And so we were talking, how are we going to involve and continue to promote both of those simultaneously, because they happen oftentimes parallel to each other. So this evolved, and over time, we've continued to grow and grow and grow. We started inviting more people to the table. At first, it was just peer recovery supporters, and then we're like, well, if what's happening is that other professionals don't understand peer support, we don't want to continue to silo ourselves. We want to invite them to the table so that we can educate them on what peer recovery support is, and we can build this continuum of care together, understanding that peer support is an integral part that can be easily be enmeshed into any part of the continuum of care. So we call ourselves a network of practice, and we focus on the philosophy of peer support, and we're able to merge that into this large group where we share a mutual understanding. We bring together a variety of diverse perspectives, and we do that in order to network, to learn, to share, practice, and grow together. So on the front lines, focuses in workforce development through education, collaboration, and innovation. The bulk of the work that we do is centered in the well-being of individuals with lived experience working within the recovery space. So what we offer is upskilling. We focus on equipping the workforce with the necessary skills to be effective in the services they provide. We mentor, we offer support in the certification process of becoming a peer supporter. We create spaces for the workforce to be able to connect, grow, thrive, evolve. And then we also reinforce workforce retention. We do that through sustainability practices and well-being services. And then we also consult. So we work with different organizations, different panels, different institutions, policymakers in order to offer insight and to inform programming around best practices for peer recovery supporters. Do I have any questions yet in the chat? I haven't looked at it. Rachel?
Haven't seen any yet. Lots of good comments about people sharing about the work they're doing and affirming the
Yes.
things you're saying.
Just want to make sure before I move forward. Thank you so much. All right, so what are some of our goals? We come together organically. This group naturally formed. It continued to evolve into this large network. We realized at a certain point that with the unionizing of all of these recovery professionals, that we had the capacity to make change as a union. So, we built and organized and mobilized this recovery community of professionals. And what we wanted to do was elevate the role of frontline support workers. Individuals that are working on the front lines have their ear to the pavement. They are dialed into the needs of individuals that are currently seeking services. And they have this really dynamic perspective of also of using substances and navigating the system themselves. Why are they not at tables where decisions are being made? Why are their voices not at the forefront of a lot of programmatic exploration? I'm not sure. That's why we decided to mobilize. So how are we are focusing on pursuing various ways to engage the community, to contribute our expertise, and to raise the voice of individuals with lived experience working in the recovery space. And we do that through partnership. So we want to impact how recovery wellness efforts are understood, organized, funded, and shared. So our mission statement entails making sure that addiction response efforts are relevant, person-centered, and informed by lived experience of those affected by substance use. We do this in a pretty strategic fashion. So our goals are to advocate for individuals with lived experience, involving people with lived experience, amplifying the voice of people with lived experience, and then also engaging the current workforce and helping them advance. So we want to make sure that we're educating peer recovery supports professionals and other professionals that work with peer recovery supporters to be effective advocates themselves, and then also amplifying the voice of lived experience by participating in different panels. We also are on a few different policy programs. We're on coalitions, both local and state. And so we want to unite those diverse voices of those affected by addiction to make more programmatic and strategic change. So currently, the foundation of what we do is broken up into 3 different segments. So we have our supportive services, which is our priority care chat, which I'll talk about in a second, and then the resource database, which is relink.org. We've helped inform and continue to support through a mutually beneficial partnership. We have our community gatherings, which are our monthly networking events where we gather together to share resources, promote collaboration, and build rapport amongst individuals representing agencies agencies. And then we have our Peer Advisory Council, which is a group of elected peer recovery supporters that are seasoned in the field that participate in those coalitions or those large level conversations around programs and solving specific community localized concerns related to substance use. So our priority care chat is through Slack, and this is I was going to put some pictures up of what Slack is, but they're kind of boring. They're really just, these conversation threads, but we have about 8 conversation threads that happen daily. And what this is meant to be triage care coordination. If somebody, when I was working for the quick response team, I could only keep so much resource understanding at the forefront of my mind. Everything else kind of got archived. And when you're in a situation with somebody where you're doing crisis intervention, it can be difficult to be able to siphon through them, the catalog of resources. And so what the Slack chat and the priority care chat is meant to do is focus on collaboration. Like, I don't have to have all the answers in this moment. I have a network of people who are willing to share freely the resources that they know and understand and also represent. And so when somebody gets on the Slack chat, we might have a concern where I have an individual who is disabled and isn't able to maintain their activities of daily living. They have substance use disorder. They're on a medication to support their substance use disorder, and they have a service animal. That's a pretty complex situation for somebody that's seeking services. The point of the priority care chat is to bring a diverse group of professionals together to break down those resources as a unit to make it a lot more attainable and to ensure that the person that's receiving services knows that recovery is available and accessible through the collaboration of recovery professionals. So we currently have 436 members on that Slack chat. So that's 436 different perspectives, different professions, different job titles, different organizations that are represented on this Slack chat. So a lot of barriers get broken down on a daily basis. Again, really grainy picture. Not sure why it downloaded like this. So sorry for that, but this is a picture from one of our networking gatherings. We have been doing our networking gatherings since 2018. We have, on average, about 64 individuals that attend our monthly gatherings. And this is just some data from the last year. So over the last since 2023, we've had over 154 unique attendees at our networking gatherings. A lot of people, we have our consistent stakeholders and their regular attendance. Some individuals come and go. It's a very informal event. We allow people to come, early, late, leave as they need to. There's really no commitment required, because if anybody on here works in recovery support services, you know that your workload really defines what you're going to be able to do that day. So even though, people often prioritize networking and resource events, oftentimes they get put to the side because of the demands of our daily work. We had 35 unique titles, 56 unique organizations, and each networking meeting, we ask individuals how On the Front Lines was able to contribute to their day-to-day workflow. And we also ask them how many connections to services they made over the last 30 days in partnership with On the Front Lines. And since the beginning of 2024, we've had 959 anecdotal responses on how they've gotten people connected to services because of the On the Front Lines group, which is incredible. Sometimes still mind-boggling to me. So I wanted to share with you how can you join a networking meeting. This is an open invitation. Everybody is welcome. We have 2 different meetings. The first one is in Hamilton County, Cincinnati, Ohio, and we meet on the first Tuesday of the month at Ohio Means Jobs, which is in downtown Cincinnati. And then we also have one in Dayton, and that one's on the last Friday of every other month, so bi-monthly, and it's on the last Friday of the month, which sometimes can be like the 5th Friday of the month. And that one happens at Dayton's Metro Library. our peer advisory council, which I know that we have one of our peer advisory council members on the group. Erica Parks is on the group with us today. And I talked a little bit before, these are dedicated representatives of on the front lines. They are seasoned recovery professionals working in the peer support space. Each one of these individuals have diverse perspectives. They have different connections to local resources. They have very diverse backgrounds when it comes to their process of recovery and what their active use look like. So each one of them is able to bring some very unique gifts to the table. And our whole goal is to be able to contribute those gifts on a more macro level. I wanted to introduce our peer advisory council. And then I want to talk about some of the partnerships that we've created through On the Front Lines and how we've been serving our community. So two of our partnerships are with Hamilton County's Addiction Response Coalition, and another one is with Strategies to End Homelessness. So these are some larger organizations that make a lot of decisions around funding and different program areas within Hamilton County that we've been invited to help support. So, with Strategies to End Homelessness, we've helped inform their strategic plan. So, we've helped them develop their own. We helped create a strategic plan for a work group. So, there was a work before On the Front Lines existed, there was no voice of lived experience supporting strategies to end homelessness. So they created a work group called the People with Lived Expertise. And Erica and I are both on that work group. I am the chair of that work group. And so we've created our own strategic plan. We added a lot of input to from the work group to be able to um, edit some of the existing screening tools. We've also helped with focus groups and how to change policy for how we might influence what programs and what organizations are funded. And then we also have helped create data collection models. And then the Addiction Response Coalition, this so I want to go back a couple of slides because I kind of breezed through this. So in the Addiction Response Coalition, they have 7 different pillars that are representing the recovery community, in terms of addiction response. They had a business pillar, a treatment pillar, a prevention pillar, an interdiction pillar. Um, I'm missing some, but there was no pillar to get dedicated to recovery, or there was also a faith-based pillar. I'm sorry. But there was no pillar dedicated to the voice of lived experience, and nobody on the steering committee was there just as an individual with lived experience, speaking directly from their perspective of being somebody in recovery and navigating the recovery system. So in 2023, the Peer Advisory Council presented to the Addiction Response Coalition on the possible partnership and how we might be able to bring the voice of lived experience to the coalition. And in December of 2023, they created an entire pillar that emphasizes the role of lived experience in some of the initiatives that are being created. So the work that we're doing there is increasing representation on the steering committee. We're also making sure that we are quantifying the number of linkages to care that are facilitated through the recovery pillar, which I kind of shared with you earlier on some of those numbers. We are continuously collecting information on what barriers recovery professionals are encountering in the community. And then we serve as a feedback loop where we're sharing those barriers with the steering committee as a whole, where all of those different pillars are able to come together and create solutions that are, again, informed by people with lived experience. And then I also want to talk about our partnership with Relink. So Rachel talked about what Relink is, how it's this free comprehensive resource database. We realized that as we were working to move forward in the capacity of On the Front Lines, that one of our goals was having the holy grail of resource guides. Every recovery professional that I know, when they first get into the field, they create their own resource guide, their own resource manual. They start gathering all of these resources, whether they compile multiple different resources guides together or they start making their own. And what happens is it's really difficult to maintain the relevance. It's really difficult to maintain it. I talked about earlier how often workforce retention is difficult in our field, and specific individuals or contacts change often in reflection of an organization. So On the Front Lines decided to partner with relink.org in order to make sure that resource navigation for recovery professionals was seamless, so that trying to navigate what resources might be appropriate, or who's the best contact person, who's the current contact person, what insurance do they accept. Again, trying to pull from all of that from the archives of my mind can be really difficult in real time. So our goal was to be able to download all of the resources that On the Frontlines members had compiled from years of working in the field to relink.org to be able to update their um, resource page, and for us as resource providers to be able to use that as the trusted source of information here in Hamilton County. So you can see since our partnership, we usership has went up 16%, and that we've new users has went up 17%. Engagement time has went up 31%, and I think a lot of that has to do with recovery professionals are now um, using this resource, this database, not just individuals in the community. So we've sort of extended the usership of the website. And then Rachel talked about the importance of maintaining the relevance and the appearance and the accessibility of organizations. And we have continued to echo that narrative throughout our community. So we've had 148 organizations either create or update their account on relink.org, which is just ensuring that if individuals are looking or searching for resources or services here at On the Front Lines, we promote having a personal contact at any organization so that you feel confident when you're making that referral, that you're not just contacting an admissions line. That can be a barrier for a lot of people who are seeking services. When we're at all of our networking gatherings, we're gathering personal contact information so that when we're in front of somebody in real time and we're talking about a resource, they can tell if we are confident in that resource's ability to meet their needs, and if it's a trusted source of information. And usually that's because um, we seem to be able to put businesses behind the people that are representing them. So if I'm building a personal relationship with somebody at an organization, I'm more likely to feel confident in making that referral. And so that's the purpose behind updating and maintaining the accessibility of your organization on relink.org. Next, I just want to talk about some of our success stories. So Glenn Collins is an individual that utilized On the Front Lines for all of its capabilities. So he first attended On the Front Lines in August of 2021, and this was because he was actually a representative of a subcommittee from a local 12-step fellowship, and he was coming to share about that 12-step fellowship at our On the Front Lines meetings. And from there, he was moving into retirement and saw that he might have a place with being a peer recovery supporter. So he started attending our On the Front Lines meetings regularly, and he received training through On the Front Lines and was able to become certified as a peer recovery supporter and certified as a prevention specialist. And then later on in 2022, he was able to gain employment as a peer recovery supporter, and we were able to help him advocate for a pay rate match, because the pay rate that he was originally offered didn't match the value in which he brought to the position, nor did it really compare to the rates of other peer recovery supporters in our community. So we were able to help him advocate for a pay rate increase. And currently, he's attended the last two Ohio Pro Summits. He is a work group leader for our peer sustainability and wellness group, and he's also getting ready to become a trained supervisor for peer recovery support specialists. Next, we have Tara. And Tara first started joining on the front lines in 2019 through a project called Empower. And they are working with individuals who conduct research, which is like patient-centered research for individuals who have been pregnant or postpartum at or around the time of pregnancy. So they were coming to on the front lines to speak about Empower, promote Empower, and discuss the value of Empower. Um, she then started attending on the front lines on her own and starting considering how she might be able to make a profession from her knowledge and expertise from experiences being a mother of three and experiencing substance use around the time of pregnancy and postpartum. So in 2022, she got connected to the Addiction Services Council through On the Front Lines to get her peer recovery support training. She then got another certification as a community health worker, which is a 16-week training. And she was able to get that certification and that entire training covered through an internship that On the Front Lines partnered with. She then was able to do her first keynote presentation as a member of Empower, where she had never presented to a large group. She was able to create that presentation on her own. Then she also got her crisis interventionist training credential through a partnership of On the Front Lines, got her Kentucky peer support certification, and today she is currently employed using her peer recovery support certification here in Hamilton County. So just to kind of wrap everything up, On the Front Lines was formed out of common interest and shared experience. We are a group of recovery professionals that are actively working towards the continuum of care to support communities and facilitate successful reentry for individuals seeking recovery support services. We are focused on leadership. We want to be able to create partnerships with non-traditional partners such as peer recovery supporters in more of a leadership capacity so that we can be central to the success of recovery support services. And then through partnerships and networking, we hope to be able to promote the right resources for individuals, breaking down any considerations of retention or competitive nature so that we can promote advocacy, education, and be able to demonstrate the long-term success of recovery. And that's all I got today. I want to thank everybody for tuning in and listening to On the Front Line success and our evolution and where we are today. And hopefully we have some questions that we might be able to
Thank you so much.
get to.
Great presentation. Let's look over here. So we have some comments. Lori said, I absolutely adore my position. We have several people who were just thanking you for the information, great information. Will they be able to get a copy of the slides?
Of course, absolutely.
You will be able
It's a
to.
lot of information to be able to download.
Yeah.
And so we absolutely want to make sure that you can go back and refer to them.
We're saying they appreciated the information. It was great to see those journeys. Are the relink resources only for Hamilton County? No, we're in all 88 counties, so you can go on relink and access those resources in all 88 counties. Lots of people saying thank you. Oh, we got a dope presentation.
Ooh, I like
Good
that.
job. One person was asking, what do the meetings look like? Like, I guess maybe the structure or how long they are or what you guys
Yeah,
do.
the itinerary. Yeah.
Yeah.
So we meet for about an hour and a half. And again, we're really informal. The very beginning of the meeting, I call it munch and mingle. So everybody's able to go get lunch. We have lunch catered by one of our sponsors. Our events, currently, we are fully self-supporting. We invite organizations throughout the community to sponsor our lunches. And sponsorship gives way to membership, but it also allows for that organization to share some of the unique programming or come in and do an education that might be specific to the clinician that they're sending to the On the Front Lines meeting. But the first part of the networking meeting, we are just spending time together, breaking bread, laughing, getting settled. And then after that, we have our sponsor come up and share a little bit about their organization or them as an individual, or be able to educate us on something specific to their licensure certification. And then after that, we go around and we get to know each other some. I'm really big on icebreakers, and it's created a lot of really incredible conversations. So we go around and introduce ourselves. We talk about where we're from, what we do, and we do a little icebreaker just to do something a little bit more personal.
Would you say, how quickly can that information be shared? I know you were showing those Slack chats, or if somebody is in crisis, how quickly do you think that their needs get met through those different Slack channels?
Again, this is all on the front lines is created for the recovery community, and it belongs to the recovery community. So it's really just based on who's readily available. I know oftentimes responses are instantaneous,
Yeah,
and yeah,
same.
some responses are instantaneous. Sometimes the response might not be like, "Hey, call me," and the care coordination and resource brokering kind of unfolds from there. We oftentimes don't get to see like the full evolution of a you know a barrier being broken down on the Slack chat. It's usually like some offline conversations that happen between partners, and we oftentimes share those in our newsletter. So we do publish a newsletter monthly in correlation with our networking meetings. So we publish a newsletter the day before our networking meeting, and that allows for our sponsor to be able to be spotlighted, and it gets sent out to over 1,600 recovery professionals. So it's a pretty great visibility and marketing um, opportunity for our sponsors. But we also share a success story, and most of those success stories are in relation to and spotlighting the coordination and collaboration between multiple partners to serve one individual.
That's great. Are you planning on expanding those meetings into other areas?
I get asked that question all the time. So Dayton started about a year and a half ago, and it is finding its rooting. And I feel like it's blossoming up in that community. It can be really difficult because on the front lines is a venture that I do on my own personal time. I have a full-time employer that I work for, and so on the front lines is something that I've always found extremely beneficial. The community has as well, and so I invest my personal time in it. What's difficult is finding a community champion within each one of those pockets of our state or in different states that are willing to align themselves with the mission of On the Front Lines. Because On the Front Lines does have like sponsorship, it's really important that we don't endorse organizations. On the Front Lines doesn't ever take a stance on organizations or really a lot of like public affairs when it comes to organizations that might be operating without integrity. What we do, man, what we do is teach individuals and walk individuals through the process of reporting and the importance of like a judicial process. So what I'm trying to respond to the question, no, I don't currently have any plans of expanding. Um, if there are individuals that are interested in bringing the concept of on the front lines to their community, I would encourage them to reach out to me, and we can discuss what that might look like.
Erica said through OTFLCA and Hannah, I was connected to Ohio OMAS online peer supporter supervision training, able to advocate for this within my own team with the support of OTFLCA. We have lots of great presentation, great information. Let's see. Oh, someone likes the cute little cows in the background. Is that cows in
Those
the
are, yes, I got a little piggy, I got cows, and that's kind of a big deal. Those are my daughter made those. That's great
Oh,
because I had my background blurred, but it was cutting off like a really interesting portion of my
yeah,
face,
I
which made
like
my
this stuff.
anatomy. Yeah. And so I'm like, you know what? I'm just gonna invite everybody in. to my space today.
So Cassandra said, no, we always need cows. She did not want the cows. So how
No,
can people contact you directly with any of information that they would need or
no,
things
that's a
they
great
want
question.
to?
I'm
Mhm.
actually going to share my screen again because I
Okay.
want you guys to be able to see that we do have a website.
Oh, perfect.
It's frontlinescommunity.com, and I'll make sure to put that in our chat. And this, is a great resource to be able to, one, learn a little bit about who we are and how we serve the community. You can learn more about our peer advisory council and our board of directors. But there's also a whole tab on how to get involved, joining our movement, what it might look like. There is a place and a position for everybody and on the front lines. And so we definitely invite you to come and learn more about how you can bring your unique skills and talents to our community. We do have an entire link designated to our partnership with Relink. We want to make sure that we can get quality care coordination and making referring to resources streamlined and effortless. So we have our, partnership with Relink really easily displayed. When I was talking about that earlier, like Relink is more uh, your guys' main office is more towards central Ohio or northeastern Ohio. So building the partnership with on the front lines, we are centralized in Southwest Ohio. So it was really just expanding the resources to this area. It's really easy to anybody can get on Google and search recovery support services or search inpatient treatment, search stabilization. But what we offer is our connections with those organizations, understanding exactly what referrals that they're able to receive, also giving them direct contact information for the people that work there and helping them maintain those resources so they're up to date. We also have a whole tab on peer workforce development. So this is going to go through the certification process. We have tons and tons and tons of continuing education resources. One thing on the frontline prides itself on is free. Everything that we put out into the community and everything that we place on our website is all going to be free. We want to make sure that there really is no barrier to people getting continuing education. So this entire resource list, all of these are going to be free continuing education resources. There's also information on here for employers of peers. I saw somebody put in the chat that they are currently not supervised by somebody that's a peer. They're supervised by a therapist. And that's something that on the front lines is been working to advocate for is having peers supervised by other individuals that also have lived experience and kind of reshaping the narrative behind what supervision is, because oftentimes we see people that are going through the recovery process, working in the recovery space, feeling like they're being counseled and not supervised. And the last thing we have on here is our community calendar. We do share resources all the way through Dayton and a little bit past, but most of these community events and resource professional development opportunities are going to be centered more towards the southwest region of Ohio. And then you said contact. Well, there's a whole page on how you can contact us. So I'll make sure to put this in the group chat or in the chat.
Well, I will be happy. Somebody said they were jumping off, but that they're looking forward to receiving these great resources via the email after the event. So I always send out an email that'll be a follow-up email to this webinar. I'd be happy to include the direct link to the website and the slides and anything else Hannah would like me to share with everyone. Well, I thank you all today for joining us. That was a great presentation. I appreciate all the hard work you do. I know you said you do all of this on your own time in addition to your full-time job. So I know it's a blessing to so many. And I was just kind of asking you how efficiently the Slack chats work, because I remember when I attended one of the meetings, just people talking about how they were easily able to connect with other providers and get help for people in need so quickly. And I think that's just a great idea. You guys have a lot of great different ways and modems of how you're sharing information and collaborating together. That's really working. So appreciate you coming today. Lots of
Thank
comments about
you.
how it was a great presentation, and hope everyone has a great day.
Thank you.
Thank you.